I was sitting at my desk the other day and I noticed something strange. The text on my computer screen had become fuzzy. At first, I thought maybe I needed to clean my monitor, but then I realized it was my eyes. I had blurred vision. Now, blurred vision is one of the most common eye problems that people experience. And if you are watching this video, chances are you have experienced it yourself at some point in your life. Welcome to Eye Conditions Explained, where we help you understand the medical side of your vision using simple analogies, clear explanations, and real-world examples that make sense. In this video, we are going to explain what blurred vision is, what causes it, how it affects your daily life, and most importantly, what you can do about it. So let's start with the basics. What exactly is blurred vision? Well, think of your eye like a camera. A camera has a lens, and that lens focuses light onto film or a sensor to create a sharp, clear image. Your eye works the same way. You have a lens in your eye, and that lens focuses light onto the back of your eye, which we call the retina. The retina then sends that image to your brain, and your brain interprets it as the world around you. When your eye lens focuses light perfectly onto the retina, you see a sharp, clear image. But when something goes wrong with that focusing process, the light lands in the wrong spot on the retina, and the image becomes blurry. This is blurred vision. It is essentially your eye's focusing system not working properly. Now, there are many different reasons why your eye's focusing system might not work properly. Some are simple and easy to fix, while others might require more attention. Let's talk about the most common causes of blurred vision. The first and most common cause is something called refractive error. Now, this is a fancy medical term, but it basically means your eye shape is not perfect for focusing light. Think about it like this. If your camera lens is slightly bent or shaped wrong, it will not focus light onto the sensor correctly. The same thing happens with your eye. There are four main types of refractive errors. The first is myopia, which we commonly call nearsightedness. If you are nearsighted, objects far away appear blurry, but objects close to you appear clear. This happens because your eye is shaped slightly too long, or your cornea, which is the clear front part of your eye, is too curved. This causes light to focus in front of the retina instead of directly on it. The second type of refractive error is hyperopia, or farsightedness. This is the opposite of myopia. If you are farsighted, objects close to you appear blurry, but objects far away appear clear. This happens because your eye is shaped slightly too short, or your cornea is not curved enough. This causes light to focus behind the retina instead of on it. The third type of refractive error is astigmatism. Think of your eye like a basketball. A basketball is round and symmetrical, but with astigmatism, your cornea is more like a football. It is not symmetrical. It is curved more in one direction than another. This causes light to focus on multiple points inside your eye instead of one single point on the retina. The result is blurred vision at all distances, both near and far. The fourth type of refractive error is presbyopia. This is something that almost everyone experiences as they get older. As you age, the lens inside your eye becomes less flexible. Imagine a rubber band. When it is new, it is very flexible and stretches easily. But over time, a rubber band becomes stiff and does not stretch as well. The same thing happens to your eye's lens. This makes it harder to focus on objects that are close to you. That is why many people in their 40s and 50s start having trouble reading without glasses. Now, refractive errors are not the only cause of blurred vision. There are many other conditions that can cause your vision to become blurry. Let's talk about some of them. Cataracts are one of the most common eye conditions that cause blurred vision, especially as people age. A cataract is when the clear lens in your eye becomes cloudy. Imagine looking through a frosted glass window. You can see shapes and light, but you cannot see fine details. That is what a cataract is like. It usually develops slowly over many years, and it is very common in older adults. The good news is that cataracts can be treated with a simple surgery where the cloudy lens is removed and replaced with a clear artificial lens. Another cause of blurred vision is dry eye. This might seem surprising, but moisture is essential for clear vision. Your tears cover the front of your eye and help it focus light properly. When your eyes do not produce enough tears or your tears are not of good quality, your vision can become blurry. This is especially common in people who spend a lot of time staring at computer screens or phones. You can treat dry eye by using artificial tears, blinking more often, or in some cases, using special medications or devices. Diabetic retinopathy is another serious cause of blurred vision. If you have diabetes and your blood sugar is not controlled properly, the small blood vessels in the back of your eye can become damaged. This can cause swelling and bleeding in the retina, which leads to blurred vision. It is very important for people with diabetes to get regular eye exams and keep their blood sugar under control to prevent this condition. Glaucoma can also cause blurred vision, although it often sneaks up on you without any symptoms at all. Glaucoma happens when pressure builds up inside your eye and damages the optic nerve. In the early stages, you might not notice anything. But as the condition gets worse, your vision becomes blurry, and if it is not treated, you can lose your eyesight. That is why regular eye exams are so important. An eye doctor can detect glaucoma before it causes permanent damage. Age-related macular degeneration is a condition that affects the center of your vision. The macula is the part of your retina that gives you sharp, detailed central vision. As you age, the cells in the macula can break down, causing blurred or distorted vision in the center of your visual field. This is especially common in people over 65 years old. Retinal detachment is a more serious condition where the retina, which is the light-sensitive tissue at the back of your eye, actually separates from the eye wall. This can happen suddenly and causes blurred or lost vision. Stroke and brain injuries can also cause blurred vision. Your eyes are part of your visual system, which includes the pathways in your brain that process what you see. If you have a stroke or brain injury, the vision centers in your brain can be affected, causing blurred vision or other vision problems. Now that we have talked about some of the causes of blurred vision, let's talk about what you can do about it. The first step is to see an eye care professional. This could be an optometrist or an ophthalmologist. When you visit an eye care professional, they will perform a comprehensive eye exam. This exam will test your vision, check the health of your eye structures, and measure the pressure in your eye. They might also dilate your pupils using special eye drops so they can see the back of your eye better. This exam helps them figure out what is causing your blurred vision. If your blurred vision is caused by a refractive error, the solution is usually glasses or contact lenses. There is also a surgical option for some refractive errors called LASIK. LASIK stands for laser-assisted in situ keratomileusis. In this procedure, a laser is used to reshape the cornea so that it can focus light correctly. Many people are very happy with LASIK, as it can reduce or eliminate their need for glasses or contacts. However, LASIK is not right for everyone, and it does carry some risks, so you should discuss it carefully with your eye doctor. If your blurred vision is caused by cataracts, your eye doctor might recommend surgery. Cataract surgery is one of the most successful surgical procedures in medicine. The procedure involves removing the cloudy lens and replacing it with a clear artificial lens. Most people see much better after cataract surgery. If your blurred vision is caused by dry eye, your doctor might recommend artificial tears, medications, or other treatments to help your eyes produce more tears or use tears more efficiently. If your blurred vision is caused by diabetes, it is very important to control your blood sugar levels. Your primary care doctor can help you manage your diabetes, and your eye doctor can monitor your eyes for any signs of diabetic retinopathy. If your blurred vision is caused by glaucoma, your eye doctor will work to lower the pressure in your eye. This can be done with eye drops, oral medications, laser treatments, or in some cases, surgery. If your blurred vision is caused by age-related macular degeneration, there are treatments available that can slow the progression of the disease. These include vitamins, minerals, and in some cases, injections or laser treatments. There are also some things you can do to protect your vision and prevent blurred vision in the future. First, get regular eye exams. Even if you think your vision is fine, eye diseases like glaucoma can develop without any symptoms. Regular exams can catch these problems early. Second, protect your eyes from the sun. The ultraviolet light from the sun can damage your eyes over time. Always wear sunglasses that block 100% of UVA and UVB rays when you are outside. Third, eat a healthy diet. Foods that are rich in vitamins and minerals, especially antioxidants like vitamins C and E, and minerals like zinc and copper, are good for your eyes. Leafy green vegetables, fish, eggs, nuts, and citrus fruits are all great for eye health. Fourth, do not smoke. Smoking increases your risk of developing cataracts, macular degeneration, and other eye diseases. Fifth, if you spend a lot of time looking at screens, follow the 20-20-20 rule. Every 20 minutes, look at something that is 20 feet away for at least 20 seconds. This helps reduce eye strain and dry eye. Finally, if you have a medical condition like diabetes or high blood pressure, make sure you take your medications and keep your condition under control. These conditions can cause serious eye problems if they are not managed properly. If you found this video helpful and want to learn more about eye conditions, make sure to subscribe to our channel and hit the notification bell.